Good afternoon, everybody, and what a glorious sunny day we have today. Today, we're tackling one of the most urgent challenges schools face and asking, how can schools take a more proactive, data-driven approach to improve whole school wellbeing? So I'm Sam from The Day in partnership with Good Space, and I'm your host. First of all, let's start with a sobering fact from the World Health Organization. Youth mental health is an increasing global issue that impacts students' ability to learn and succeed. 50% of mental health conditions first emerge by the age of 14 and 75% by age 25. Students facing mental health challenges are more likely to experience poorer academic outcomes, higher rates of exclusion and absenteeism, and long-term difficulties such as unemployment and a reduced quality of life. And these aren't just short-term struggles. They can shape a young person's entire future. And today, the pressure on students is greater than ever. The rise of social media, increased feelings of isolation, and growing academic demands are creating a perfect storm for mental well-being issues. So what students and schools urgently need right now is support for all students. That's proactive, early, and specific. But what if we could spot students in need before they reach crisis point, using evidence data and not guesswork? So before we meet our speakers, just a tiny bit of housekeeping. So this session is recorded, and by attending, you are consenting to this. You'll also get the recording, your CPD certificate, along with a research white paper via email at some point this week. And we really want to hear from you throughout the session. So please drop your thoughts and questions in the chat at any time. There will also be a designated Q&A for 15 minutes at the end. So let's meet our panel. Firstly, we have Louise Morgan, the Assistant Head Teacher for Personal Development and the Senior Mental Health Lead at Pendle College in Lancashire. Louise is dedicated to promoting mental health awareness, implementing effective pastoral strategies, and creating an inclusive school environment where every student feels valued and supported. As a leader in innovative mental health initiatives, Louise has successfully implemented data screening with Good Space. Under her leadership, the school has seen powerful results with significant improvements in student engagement, resilience, and overall mental health. And then Melissa Horrocks, social, emotional, mental health specialist, also at Pendle. Melissa is a passionate SEMH specialist with a proven track record of supporting schools to embed emotional well-being into daily practice. Mel played a key role in implementing Good Space, helping create safe, supportive environments where students can build resilience and manage their mental health. Her work continues to empower both staff and students to prioritise mental well-being across the whole school community. So welcome, everyone. Before we hear from our experts, we have a question for our audience. So we should have a poll that's coming up. So I'll give you a few seconds to answer this poll. It's basically asking how student wellbeing is currently supported in your education setting. Okay, so we should be getting the results very, very soon. And we wait with bated breath. Okay. Wow. Well, that's actually really, really heartening to see. And I mean, it's probably a result of you being here in the first place. Sadly, it's not the case across the school system, as you're probably aware. So we actually conducted a number of interviews with schools ourselves. And the top challenges that actually came up was safeguarding, identifying those high-risk students who are really difficult to spot, often the ones silently struggling. Secondly, limited resource. Schools want to intervene earlier. Wellbeing leaves you are the most committed people, but you're often overstretched and lack the tools to move from a reactive to a proactive approach. And for SLT, there was a real lack of data to inform an equitable whole school wellbeing strategy. But it's very good to see a very positive result from the audience today. So over to Louise. My first question. From your experience, Louise, can you explain the importance of addressing whole school student wellbeing?
Hi, everyone. Thank you for the question and for the warm welcome, Sam. Yeah, mental health it's one of the reasons we're at school, isn't it? If mental health isn't right for the pupils who present to us on a daily basis, then they're not going to be able to access what they're learning. Unfortunately, a lot of schools have time constraints where academic grades are prioritized. However, my argument is if the pupil is coming with issues, they're not going to succeed academically anyway. So I knew when I started working at this fabulous school that I work in now last year that I wanted to be part of this pilot with Good Space so that we could identify pupils who wouldn't usually be presenting with issues. Normally, you'll all know on here, you know who the kids are who are struggling because they'll be the one breaking the windows or getting upset in a corner. The behaviour will highlight that. We'll also have heads of years saying, oh, what am I going to do with this child? But the thing I liked about Good Space was that it picks up those children who you wouldn't normally notice. So that's obviously what we're here to discuss today. The wellbeing team at my school, when I first started, I was quite unsure of what the talents were within the building. So Mel, who's on here as well today, we worked really closely together, and Mel she did an audit of the talent that we had within the building and who could run different intervention sessions. So it may be vaping, could be something to do with the behaviour, a range of things, anger. And then we created a flow chart, which then allowed us to be able to see, okay, if we do this survey, which obviously we'll come to, do we have the systems in school to be able to catch these issues? Because that's the thing. We didn't want to be finding issues and not being able to help them. So currently we've got the SEMH specialist, that's Mel. We have 2 behaviour mentors. They work in isolation, and they also work, we call it reset here, but they also work doing anger intervention with pupils who find that they're down there quite a lot. We have 2 safeguarding officers. And then we also have, we're very fortunate in that we have a head of year for each year and an assistant head of year. And I know that not a lot of schools have both. So we are very lucky there. And it just means that when we have the data, when we are doing intervention, we do have a variety of people who are able to either signpost, refer externally or deal with in-house. Okay, so without data, before data, we could only look at the pupils who were presenting in the way that I've mentioned earlier. Now, with Good Space, we can put in a preventative curriculum across the whole school, so it's really good for personal development, but also we can work on an individual one-to-one. There's so much that we can do, but that's not up to me yet. That's my bit later. So I'll hand back to you so that you can move on then with Mel, and I'll catch up with you again in a bit.
Brilliant. Thank you, Louise. Would help if I was unmuted. Okay, so it'd be really good to speak to you now, Mel, in terms of the actual practicalities. So could you explain your experience of using data screening with Good Space, how you've implemented it in the school, to the impact it's then had on identifying and supporting students?
Yeah, so I'll 2 seconds. So I'll start with how we implemented it right from the word go. So we started with the videos from the platform, which were really easy to watch, and they were very informative. We sent a letter out to all the parents, which is also on the platform, and you can make that useful for your school and make it more adaptive for yourself. We held an open event for parents too, so they could come and ask for more questions, or they were able to go through the heads of years and do it that way, whichever was helpful for them. And again, that is all on the platform to be able to use for yourselves. We then used the demo platform to be able to get used to the platform, to be able to find out what worked best for us and kind of how the questions worked, and be able to train all the staff up on it that way. We then decided to pilot one form from each of the year groups to see how it worked best for us at the beginning of the year and who we wanted to work with in what year groups would work best for us. And then from the pilots that we decided to do, we were then able to see what issues was arising in each of the year groups and able to plan for the rest of the year for each of those year groups too. From that, we also decided that we wanted to run with year 9 and year 10 for our school, because that was what best worked for our school. So from working with year 9 and 10, we've now completed with year 9 and we're just finishing off with year 10. So at the moment, I work with one form group each week, and as they have completed on a Monday, the rest of the week I then follow up with each student, depending on how many highlighted responses they've got. So I will work closely with safeguarding too. So when they come through as a critical, which we don't get very many as critical, but obviously we will have critical cases too. So all the safeguarding team will look at the critical cases, and they will identify what they will need, and we'll either do external referrals or we'll refer within our team. The rest of the cases, I will look at them one-to-one with each child and give them time to reflect on the answers that they've given. And then we'll talk about each of the responses, whether they need referrals from them, whether they've understood the questions, and take it from there on an individual case. So sometimes we'll need a referral, sometimes we'll be able to do reflective practice there and be able to give some small intervention at that point in time. So it could be on sleep, it could be on devices, it could be on low level anxiety at that point there, and then other times it'll have to go to a referral if they need more intensive work at that point. So that could be a one-to-one on anxiety, it could be a workshop around anger. It just depends on their level of need at that point. And when you do give a child an offer of a referral, some will accept it quite willingly, some will say they don't want the help at that time, and others will come back and say, actually, yeah, I'm quite happy to go for a referral now. It just depends whether they need that help at that time, or whether they think, actually, I'm not sure about this just yet, because it might be quite new to them that they've realised that they do actually need that help. So obviously, like I've said, we've got the different levels of need. We've got critical, high, medium and low, and contact us. And obviously we may not have realised that those children have had those critical and high and low levels of need previously. So the students who have identified with critical, well, obviously we'll pick those up within the 24 to 48 hours that are needed. And if a student, obviously the critical, will go to safeguarding. If they're saying, for example, something along the lines that they're wanting to hurt themselves, that may go to an external agency, or it may come through to ourselves within the team, but that will be picked up quite quickly as a referral. If it's something that was high or medium, and it was, say, for example, an anger referral, that would be picked up within the 2-week referral process that we have, and that will go maybe to a one-to-one, depending on the circumstance of the child. It may go to a week, a group referral. So when we do identify our students that need referrals, they are collated all together. They're put through a referral system, and at the beginning of that journey, at the beginning of the journey of our good space, we did the skills audit, like Louise did mention, and so that we know what all our team are capable of. So we do sit down and discuss every 2 weeks the referrals that do come through, and we know exactly what our team is more than capable of taking on. So we will sit down and pass all the referrals through to each of our team members, and then at the end of sorting all that out, we'll make sure all our team members know that. So every 2 weeks we'll go through all our referrals, pass out the referrals, and go through the caseload to make sure that everybody is able to so that they're able to go through their caseload, see if they need any additional help, whether that child needs to go anywhere different, or whether they're just managing to go through their work process. So the referrals can, the work that we do, the interventions can be anything from a one-to-one anxiety, it could be a low mood, could be an EBSA session, or it could be group on friendships, it could be groups on body images, exam stress. The list is literally endless as to what sort of intervention we do offer. So we are proactively targeting year 9 and year 10 because that works for us as a school. It might work differently for other schools. Obviously, everybody has different workloads and things like that. However, we do work closely with the heads of years as well. So we do get referrals from our heads of years, and other places. So it could be from our attendance team or other places as such. And when they do come through, we will do a good space at the beginning and the end of all our interventions, so we know whether they've made progress for our intervention, for good space, attendance and behaviour. So it's shown that good space has been really effective for us because it does pick up students that would be our wallpaper students or our hidden students, however you may want to phrase it, and that we are really pleased with everything that's been going on so far.
Can I just ask, Mel, that's brilliant to hear, taking it right back to the... Oh, have I got an echo? No? Oh, it's my end. I just want to take it right back to actually hear about the survey itself. So if you could explain to the audience, so there's templates on the system, the kind of, you did touch upon the different areas that the survey covers, and the simplicity of how students in a, say, for example, a whole year group can complete it so very quickly and efficiently. Could you just explain how that works, please?
Yeah, so we looked at the survey to start with, and we changed just a few of the questions so that it met our criteria within school and our demographics. And then the students can complete it. So we complete it within form groups just because of the workload afterwards of checking through all the questions afterwards to make sure we can pick it up at the other side. But the students come down at tutor time, and it literally takes them 10 minutes to fill it in. So they go online, they go to the website, they put the code in that we've generated for each of the capture target groups, and it takes 10 minutes to complete. It's not a long process for the students to complete. It just takes a little bit longer for the member of staff at the other end to follow up with all the students that they want to follow up with. That's why we do it with tutor groups each time.
And how quickly do you get the results of, for example, a whole year group that's undertook the survey?
If the whole year group was to do it at once, it would be instant. But because we do it in tutor groups, it's instant for each tutor group. And then it's because there's, is it 10 tutor groups, Louise? So there's 10 tutor groups in each year. So it takes 10 weeks to get through a tutor group, depending on holidays and other things that may turn up within that 10-week process.
But that's pretty phenomenal to gather such immense amount of data. From vaping to self-harm to body image to anxiety or bullying, but to get those results. And then how do you view that data before you know that the students are triaged, and what you then do subsequently with them, which you've touched upon?
So it all comes up on each of the weeks. I look on the platform and it'll tell me who's critical first, and it'll go to the highs and then to the lows. So I start with my criticals and I start working through each of the students, and I just check each student off one by one. But we also do get data analysis of the whole year group as well, so we can see out of the year group on pie charts exactly who's touched which of the questions, and we can see as a whole year group exactly what data we can see.
And who exactly in the school gets to see what data? Because is it limited? Is there a different access?
We can decide exactly who wants to see what. At the moment, we've got head teacher, deputy head and assistant head being our main on there, and all of the wider pastoral team on there at the moment.
Right, superb, brilliant. Thank you so much.
No problem.
Okay, back to Louise, and my question to you is, what kind of wider impact have you seen since introducing Good Space on the student wellbeing, both on an individual level and as a whole school culture? And then how do you use that data to shape, support and drive whole school outcomes?
Okay, well, sorry, it's because we're in the same room. It's okay. Can you hear me okay? All right, so, oh, I've gone off. Can you see me?
Okay,
no,
we can
can't see anything, so I'll just keep talking. Worry not. Okay, so it's multi-layered Good Space, because you've got the option of you can break it right down clinically to one-to-one individual pupils, exactly what the issues are for those pupils. But on a bigger, wider issue for a school, the thing that I really, really like as personal development assistant, a teacher, is the fact that it can inform your curriculum. So you can literally create a bespoke curriculum. It's not just based on the context of the area in which your children live, which obviously is really helpful, but this actually focuses on the specific contextual information that you're getting about not only the kids in your school, but broken right down into the year groups as well. So there's a bit you can go on that Mel mentioned where you can see loads of pie charts, and it's so easy to read, and you can see sort of what % of pupils feel angry, how many are worried about their weight. And what we did was, because we did a snapshot of a form per year, it meant that we could then look at the patterns within each year group. From those patterns, we could then inform our PSHE curriculum. For example, one year group was particularly bothered about their weight, whether it was too heavy, not heavy enough, and they wanted more advice on being healthy and healthy living. So that's great. I can then speak to the coordinator of PSHE. Let's sort that in that lesson. Let's speak to the head of PE and ask them to bring a little bit more, and have a look at the curriculum there. So as a big picture, it's really, really good for the curriculum. We do assemblies using the information that we've got from Good Space. We have external visitors come in and run sessions. So we've had Kooth come in and do sessions on mental health. We've had drop-down days. We had the council came in and did something on road safety, risky behaviour, that kind of thing. All of that was informed, and I specifically chose that year group that we used because that was something that would have fitted with their answers, or fit with their answers. So yeah, it's all about being preventative rather than reactive. And for me, it's having the information at your fingertips to know confidently. I know if somebody was to ask me, how do you know your curriculum is suited to your kids? I'd be able to say, well, here are the results from Good Space. Here we can show you why we've selected our curriculum in this way. It's because of X, Y, and Z. So that's the wider school. In terms of impact, where we've measured the starting place of the pupils who have come in to have intervention with us, what we've done is we've taken a measure of their attendance data, their behaviour data, and then also their Good Space data. And then once they've then had their actual intervention sessions, so this isn't the curriculum, these are the actual sessions that they might have had with one of the team. After that, they would then have another closing Good Space survey. Now, normally you don't really know with personal development if you've had an impact or not until they go out into the wide world and make the right decisions or not. But through this, you can actually see if you've made an impact, because the score that you get, you can compare what they got for the previous one. And we found that 99% of the pupils who we did intervention with had improved in at least one of the areas. So whether that was Good Space, attendance, or behaviour. So that was obviously really, really satisfying to see. So I'm happy to take any questions. The main point that I want to really get across is for kids to be happy in school, they need to have that sense of belonging and relevance. This school's relevant to me. They understand me. Through using Good Space, that gives you the information to be able to create that for the pupils.
Okay, superb. I mean, that's phenomenal to hear 99%, and how amazing as an SLT that you've got that justification, and more importantly, you can track the benefits for the student, because that's ultimately who we're all here for. Could you give us some very generic examples of, have you been able to identify a couple of students that you may believe that if it wasn't for them sitting the survey, they could have potentially been undiscovered?
Absolutely, yeah. That's one of the things about Good Space that we really like, because there would, we all have that class where there's that kid who does all the work, they do what they're, what we expect of them, and then, we might then find out sadly that something's happened once they've left school and they're an adult, and it breaks our heart, and we think, well, we didn't even know that they had any issues. Well, this prevents that in as much as we can, because it picks up those ones who, oh, I didn't know they were a carer at home. Oh, I didn't know that they were really struggling with loneliness. We've had a group of girls who all of them were struggling with loneliness. Well, then that makes sense to get them all together. Let's get them together. They can be friends. Yeah, friendship groups then. So absolutely, most of the intervention that has come our way through Good Space hasn't been the ones we already knew about. It's been new discoveries, and it's given us that extra insight into the pupils for us to be able to actually help them. And being able to see the patterns is really good. So, you'll find with 1 year group, you might have anger and emotions is really, really prevalent. Obviously, you would expect with year 11, they're worried about exams. And this now in year 10, they're just starting to worry about exams. Our aim is then to use this data to hopefully, because we're doing it in year 9 and 10 for the full year groups, our hope is that we'll be able to prepare them as much as possible before they go into year 10 to already have the skills for exam resilience and all of that. Because working in education, it's very difficult to access year 11. Once they go into year 11, it's very difficult for for mental health leads and the workers in school to get them, because they're revising and it's all about academics. So if we can make sure that we've upskilled them as much as we can right up to the end of year 10, that's what we want. And we've also, as a result of this, now we've just interviewed for youth mental health leads, where we have children who have applied and interviewed to actually become mental health leads in school. So we'll train them properly on safeguarding, how to facilitate sessions, but that's just that adds another layer of support, whilst also sort of highlighting that mental health should be something that, you know, kids should feel comfortable to talk about.
Yeah, sure. Because if we can't get their mental well-being correct, how do we expect all these amazing academic outcomes?
Exactly.
So it really is the foundation. So you've really piloted this so far with year 9 and year 10. What's next? What's the plan for September? Will you go maybe year 7s? Would you?
So the plan, we decided that we'd do another tracking. We'll do another survey at the end of sort of June, and we're going to sit down and we're going to reflect. Mel and I, we're going to reflect on the entire year, how we think it's gone. You know, we created a tracker in school that we were using alongside the information from Good Space. That's something that we're not fully happy with how that is. So we want to tweak that. Next year, sort of our forward plan is that we will do year 9 and year 10 every single year. So we'll once again do a snapshot of every single year. That will obviously take a while because we've got to get, I think probably now we've done it, we probably would be able to do a bigger snapshot. We might be able to do 2 forms instead of 1 for each. So it goes a little bit wider. But I think we will stick to getting snapshots and then doing year 9 and 10 really, really well. Yeah, because that's as well such a crucial age in terms of hormones that, you know, it's just so important. Yeah, and we will still put in mental health provision for the other years, but we won't monitor it as closely as we will with year 9 and 10.
Yeah, I know all about that. I have a year 10 in the household. So I know all about hormones and anxiety and all of that. So that's brilliant. What I've really understood from yourself and Mel is the ability to intervene on an individual student level. So obviously students in a form will sit this survey, and those critical red flags you will obviously see within 24, 48 hours. Can you talk, because you've spoken about the majority of the students that fit the bottom of the triage that are suited for an appropriate PSHE curriculum. What about the middle cohort? And what are some of the issues that have arisen? Exam stress or anxiety, body dysmorphia?
I'll pass you to Mel for this.
Thank you.
So depending on exactly their circumstances, they would maybe get that will be the referral run as well. So they would get a referral through to the person that would be best suited towards them, and they may get one-to-one support, or it may be group work depending on what they need. So we've just had somebody in again that has just done some workshops around exam stress, some body image and things like that. So very much does depend on what circumstances are, but it for each individual student, but it is either one-to-one or a group work for each individual student.
Brilliant, brilliant. Thank you. And it's worth us actually addressing some of these questions right now. So we've got a question here in terms of from Mohammed. I'll start at the bottom. How can schools balance quantitative data with qualitative insights when addressing well-being?
Do you want to do that one? I'll pass you on to Louise for this one. Does Stuart want to answer this one?
Have we got Stuart here? So we're going. Yes, shall I just introduce you, Stuart? Actually, yes. So yeah, the chat's been buzzing, so thank you for that. And I'm absolutely thrilled to introduce you to the founder, who is Dr. Stuart Jenkins. So I'll pass you over, and if you could talk a little bit about why you founded Good Space, and if you could answer the question with quantitative regarding qualitative as well, please.
Thanks, Sam. I'm a clinician, I'm a GP by training, and I'm from New Zealand originally. And we started Good Space about 3 years ago in schools in response to rising levels of child and adolescent mental health issues, particularly exacerbated by the COVID response with lockdowns, as an example. It just saw, I guess, a spike in the issues that had been trending for many years before that. Personally, it was because of a suicide of a patient of mine that really, drew attention to the fact that when it came to schools, they were really struggling to be able to manage with what they were faced with. And so what we've done is brought a clinical perspective, which is really around understanding where the research sits around this. And it led us on a trail through the University of Oxford, which runs the Oxwell study, which is the largest study on child and adolescent mental health in the UK and possibly internationally as well. To the point where we've now partnering with the Day on this. You know, what we're looking for is what are the early signals upstream that indicate that actually this child or adolescent's going to be having issues later on, or they may be actually faced with issues. There's an immediate sense of feeling suicidal, or they might be self-harming, and obviously they will need immediate safeguarding. And I think there's a stark statistic out there internationally where half the youth suicides are not known to services beforehand, because children and adolescents don't necessarily respond in the same way as adults. They don't trust that someone can help them. They don't know that they've got a problem. And so that means that there are students who are within the school setting who have got significant issues that we just don't know about. And it's as simple as asking them about what's going on. And schools have the resources in many cases to be able to manage nearly everything that they find. They're very adept at doing that. And as we've seen with Pendle Vale, who I think are an amazing example of what you can do in developing that algorithm. I think that's outstanding. Coming back to the question there's observable referrals. You've noticed someone who is behaving poorly, turns up late to class, and I think they go into the school system and are managed in a way that is usually quite effective. What we add to that is we provide background information. So when we go in and ask a range of questions, we perform a 360. So we ask what's going on at home. We talk about alcohol, drugs, vaping. So it gives a very rounded perspective of what's going on for someone at that point in time. And that allows us to be able to provide a management. And we feel that the foster intervention framework that schools use is particularly effective. So we can help find those students that need intensive support, and schools are very good at doing that. And anecdotally, the experience in New Zealand is they find about 50% more students who fit in that category than they previously knew about. And then there's the ability to manage those in a group setting, as Mel's clearly described. And then there's the ability to manage whole school responses through the PSHE curriculum or through the school strategy around climate. So there's the data really supports the existing system and just plugs those gaps that you might have, but also provides that additional background information that tells you why someone is turning up late. As Louise said, if someone's turning up late, the fact that they're a full-time caregiver, And actually a school can sort that out fairly quickly because they usually have access to social services. So that's where data fills in. And the other element is that the data allows you then to build year on year, because you actually, you can deal with the same cohort of students, and then you can see what works and what doesn't work, which resilience programs are effective, or is the teaching around vaping proving to be, is that the right vaping program to take on? So that's really helpful as well. And just to add, one final point is that we've got an algorithm within the system that triages the responses so that it helps the school identify what's actually important. And that's the clinical element that we add to it, is to say, actually, and schools are facing, we take on vaping before we take on anxiety. And we will help with that, to give some assistance to say, actually, vaping's important, but anxious students probably aren't going to be learning particularly well. So those are things that we can add to it. So I'll pass it back to you, Sam.
Brilliant. Thanks, Stuart. And it's really important to note as well, because you've made reference there, that this is really like a patient management system. So Mel has got the ability to record notes on individual students, delegate to other staff members, flag it up, and be able to follow that student's journey. So it's really important.
That's a very important point. It's we call it in our vernacular track and trace. So you're not going to lose sight of a student that you've just identified. And that's really important, because sometimes they are identified with critical issues, and you need to make sure they're not lost in the system. So there's no way they can be lost with this particular platform.
Brilliant. Thank you, Stuart. And we've got a question for Louise here. Is there a go-to activity or routine you use to support student mental well-being daily? Or it might be Mel, whoever you choose to answer.
Sorry, could you just repeat that?
Sure. So it's a question from our audience, and it's, is there a go-to activity or routine you use to support student mental well-being daily? So I'm assuming this is for the less critical students.
It very much depends on what the circumstances are, really. If it's anxiety, I might use an anxiety support plan, or if it's around sleep, I might use a specific tool on helping for sleep or devices. If it's low mood, we might look at behavioural activities and getting them out and about and things like that. So very much just does depend on what the circumstances are as to what my go-to activities would be in that specific circumstance,
Okay, brilliant. We've got another question here. What types of data should schools really prioritise when assessing student well-being? And maybe Louise, you want to answer that?
Yeah, I'll get that. In terms of the data that they should prioritise, I think it's good to get a good mix. So if you've got your good space, that gives you all of the different pastoral issues, but also having attendance and behaviour in there as well. So it depends on what your school behaviour system, how they report. We use a system called Bromcom at this school. The old school I was in, there's always a way, isn't there, in every school, how you measure behaviour. So you get the behaviour start point before you start doing any intervention, and then you would then work that out afterwards. Are their behaviour points better than what they were like before? Attendance, if a kid doesn't have a sense of belonging, school isn't relevant for them, nobody understands them, that's how they feel, they're not going to come to school. You'll have emotional based school avoidance. So attendance, they're the three that we would look at: good space, attendance, and their behaviour data. They're the main three.
Brilliant, thank you. And another question from the audience: how do you stimulate any kind of discussion at school? confidence in speaking is really important.
So at this school, we've introduced something whole school, where we've got a talk template within every single classroom. This actually was just by pure coincidence. I could say, oh, we did it as a result, but we didn't. It's pure coincidence. But across the school, all of our pupils are given sentence starters, every subject made like a laminated sheet that helps them know how to actually put sentences together, and every child is expected to be able to contribute. It's worth mentioning as well that the school that we work at, it's not a really wealthy school where we've got all this money for loads and loads of resources either. We really make everything work. Everything that we've got in school, we make it work. And I know that when Mel gets them, and I know from when we've had the interviews this week and we've spoken to the kids, a lot of it, getting them to talk, is about just letting them know that you're there. And they don't have to talk. They could just listen. They can write a little note. The main point is that they know that there is somebody to talk to. And we really value signposting. And I don't know if any of you have heard of Kooth, but Kooth has been a really, really good online tool where that's a really good one to signpost for kids, because they can just go, if they're struggling, they can go online and straight away, it's all confidential, and they get somebody that will respond to them straight away. So that's Kooth, Kooth. I would really, really recommend that one.
Brilliant. Thank you, Louise. And Dr. Stewart, you really want to answer the question on prevention that's appeared in the chat.
Yes, prevention is it's much more effective than waiting for issues to present when they're actually causing real problems. So obviously we use screening in disease, whether it's diabetes, heart disease, cancer, and you're looking for the early signals so you can intervene and prevent things happening. And to give a couple of really quick examples, the biggest study in Australia is showing that poor sleep will double risk anxiety, depression, and suicidality in children and adolescents. So measuring, is sleep an issue within this year is actually can be very effective in preventing anxiety and depression, and also improving safeguarding. And the same with connections. So that's the second thing that they've shown will double the risk of anxiety, depression, and suicidality. So if there are poor connections within that particular year group, then you can look at forming friendship groups, and sometimes, they could be subspecialized to rainbow friendship groups, and schools are very adept at managing these.
Yeah, brilliant, brilliant. Thank you. And we've got another question from Mohammed. It does say in relation to international schools, but I think this is actually appropriate globally. Is it a good idea for schools to engage parents and the wider community in data-driven wellbeing strategies? And how can this be done effectively? So maybe, Louise, you could take this on in terms of your experience of Pendle Vale and the inclusion of the wider community.
Yeah, I think always involve the parents and the families. We're not doing anything that they wouldn't want to know. It's great that our parents really like the fact that we're looking at their child's mental health and making sure that they can access their school experience every day, because we've got their back and we're making sure they're okay. So yeah, I don't think it matters, where your school is based. I know some people think, mental health's not a thing, and why are you digging around, and and I can get that. I get that, but on the whole, parents, should be able to be involved in it, and also it takes you on to the next step. We were looking at maybe doing a how to parent a teen workshop where parents can come. Because like you said yourself, Sam, it's very difficult parenting a teen, and they're all different. Some of them are horrible and some of them are lovely. And it depends if it's a Tuesday or a Thursday as what mood they're in. And it would be really good, I think. I think going forward, we will be bringing in parental workshops. And like Mel said before, we sent letters out informing them. We offered them to come in and have tea and biscuits with us and to chat, you know, about it. They didn't, because I guess they knew that what was on the letter was obviously sufficient enough information. I can see one of the letters there, it says, but what if the abuse is coming from the home? I get that. You might think, well, that could be a difficult one. The parent could say, well, I don't want them to be asked any questions, but then that in itself would raise a little bit for me. You know, I would think, okay, that's fine. Well, they don't have to do that survey, but I would have a little chat with them, and it would actually highlight that child to safeguarding, to be honest. So either way, it's a win-win.
Yeah, no, of course, brilliant. Okay, superb. So is it an opt-in or an opt-out? I suppose at the beginning, when we all know as parents, when you sign your children up to school, there's a level of almost, dare I say, handing them over during the school day.
So the letter that was sent out was for letting them contact us for more information and more for them to opt out. We were just letting them know that your child was going to be doing this survey, and if you wanted any more information, then please let us know. So that was what the letter was about, really.
Brilliant, thank you. And probably a question to Dr. Stewart in terms of, have you got any research or statistics on will young people be more inclined to answer questions digitally or face-to-face?
So the feedback that we've had from schools is that students like the digital interface. They feel very comfortable with it, and they like that they've been asked. One of the things that we do is put the school crest or logo on the questions, and it adds that personal touch where they feel comfortable providing answers. Now, I think it's you know, we just talked about parents being involved. That whole school community need to be involved so they understand what the problem is trying to solve here. And sometimes it can be framed quite nicely as, look, we want you to be successful in life, and actually we're aware that, you know, to learn better, it's really good if you're not anxious and if you're not struggling in any areas. And once we know what's going on, then we can help. And students really appreciate that. So that engagement's a critical element.
Brilliant. And I suppose leading on very nicely from that is a question to Louise, because if you are a student cohort and your school is very seriously taking issues that are prevalent amongst peer groups and year groups, and then the PSHE is directly, the curriculum is directly answering that, surely that's a good thing for students to know, that the school is taking very seriously their specific needs.
Yeah, absolutely. And that's where you link to the sense of belonging, isn't it? Pupils can see, you know, we did an assembly after one of the year groups and said, following the Good Space survey, you know, a lot of you discussed how weight was an issue for you, and, you know, we are listening. This is what we're doing in response. We've spoken to PE. So we are very much keeping it an open dialogue so they know. And then also we share all the information with the heads of years and the assistant heads of years, so they're also aware of the issues within their year group. It just helps to have that extra information about them, and it would be interesting next year to see if the same issues follow the year group or become a pattern for that particular age group. So yeah, that's something that I'm quite looking forward to seeing next year.
Yeah, no, I can imagine. Brilliant.
Yeah, Sam, I was just going to ask if Louise, you might be able to confirm that certainly schools in New Zealand report that students over-report in terms of particularly the critical risk questions, which are around sexual harm, physical harm, suicidality, and self-harm. And so those students will need to be risk assessed within the school environment. but as many as 80% of those are not necessarily issues that are current or actually relevant. Sometimes they might just want to talk about their friend they've got concerns over. So it's probably more of over-reporting than under-reporting, but Louise and Mel, it'd be really good to get your comments on that.
Yeah, we've had a couple of cases of that where they've over-reported, and it might just be that actually this has happened, but I'm not sure if it meets that criteria, but I want to talk about it anyway, and then it's not actually met the threshold of the sexualisation question. But they've spoke to somebody, they felt happy about it, and then they've moved on. So yeah, we have more over-reporting than we do under-reporting, which is a good thing, because at least then we know that they've been able to speak about something to somebody, they felt much happier, and then they're happy to go on the way. So at least then we know then that the student has been happy to talk about whatever they needed to talk about. Because even though we have it up all over school, you can talk to this person, you can talk to that person, these are the people that you can talk to in school. They don't know always how to bring that conversation up. So at least this way we know then that they can speak to somebody when they need to.
Brilliant, superb. Well, that concludes our Q&A. Incredibly insightful conversation. Just want to say a huge thank you to our panel. So Dr. Stuart Jenkins, thank you for creating Good Space and doing the wonderful work that you're doing and making a real impact on individual student outcomes. And secondly, very importantly, to Louise and Mel, for talking today about your experience of effectively implementing Good Space and the impact it's had on your own resource and managing mental wellbeing effectively, but really importantly, identifying those students that may well have gone unnoticed. So just to recap today, Good Space is a whole school data screening tool, and it really enables safeguarding leads to identify those previously unknown high-risk students. Then for the wellbeing and SMHL teams to really prioritise effectively and maximise their resource, you can really give the attention exactly where it's needed and in the right timeframes. And for SLT, as we've heard from Louise, I mean, how exciting is that to be able to map attendance, behaviour, academic outcome against these results and be able to track them over time, so you really know your student cohort and then can deliver a very well-informed curriculum and wellbeing strategy. So if you'd like to hear more about Good Space data screening, we are working in collaboration the day with Good Space. We would love it if you would email us on goodspace@theday.co.uk, or you can fill in the linked form within the chat. We'd love to continue this conversation and really make it specific for your student and for your students and your demographics of your particular school. So do please get in contact. We hope you've felt that this session is incredibly informative. It's very important what's being done here. So just want to say thank you to the audience and thank you to our panel once again. And please share the recording far and wide, because this really is a brilliant tool. Thank you.